I'm Dr. Alan Muskett from Billings Plastic Surgery, and I'm here with Tricia Kelly, who's a registered nurse who works here at Billings Plastic Surgery as well. And what we're here today is to talk to you about breast augmentation. Now, you see a lot of advertising for breast augmentation, a lot of fancy websites, but we would like to give you today kind of a real view of what breast augmentation is like, what it's for, what to expect, and really pretty much everything you need to know about it. Let's talk a little bit about implants themselves. We have a new generation of implants now that are kind of the latest, greatest thing called Inspira, which is kind of a cool sounding name for an implant. It's a little overblown, but there are, I think, basically two kinds of implants in the market right now. There's that which is a silicone envelope filled with saline, which are called saline implants, and then there's the silicone gel implants. So why don't you tell me, Tricia, what's your thought about on those two kinds of implants? What have been your observations in your career?
When I first started here at Billings Plastic Surgery, 10.5 years ago, I walked into a time frame where all we could do was saline implants, and that was all we had choices of. There were some loopholes that someone could get gels, but primarily it was saline for for someone seeking augmentation. About 3 years, probably about 8 years ago now, they then were now released on the market. Way back when, 20 years ago or so, there was a big scare that gel would leak out of the gel implants and run around in your body and cause connective tissue disorders and other stuff. So they were pulled off the market and studied very intently and intensely as far as those types of concerns. In fact, we were an investigative site at that point to look at that specific issue for many, many years. And we saw patients at 1, 3, and 5 years and asked a bunch of questions. Long story short, after data compiling and all that, totally not connected. They weren't able to make any connection with gel issues. That's what most people are worried about when they come in. They say, gel, well, I hear it's not safe. I'm scared about it. They've been around a long, long, long time. Say 40 years at least? Easily. So really, they've been tried, they've been true, they've been tested, and they just haven't been able to make any real connection with anything. So that part you can kind of put to the side. Now, with saline versus gel, saline tends to feel harder. You think of it, fill up a water balloon and you push on it, it's hard. You take a gel substance, put it in a balloon, and it's going to feel squishy. So gels tend to feel more natural, particularly if you don't have a lot of breast tissue to begin with, or soft squishy, I call it. If you don't have a lot of soft squishy, then a gel...
That's what we want.
A gel implant will certainly make things feel more natural. You have less rippling issues. Rippling, what's that? Well, if you have thin tissue or not a lot of soft squishy, gel or silicone saline can get what we call rippling, of what you can see with the balloon or the water sac that's underneath the breast tissue. So gels have less incidence of rippling. They are more natural, softer, and I think they tend to give a little bit more support and lift because you actually are inserting a solid versus a liquid into the tissue. So it has more lift power and a little bit more support, and they just look softer. And more
I think so too, and I think you can tell looking at them, or you can't tell.
Right.
Which is even better. You can't tell they're there. Okay, I'm going to show you a few examples here of the different kinds of implants. Now, for instance, this is a saline implant, and that is a silicone envelope which is filled with salt water. And so this is not completely full, but you kind of get the idea of how there's fluid inside that implant. Now the next thing up on the ladder is a traditional silicone gel implant, and you can see they have more shape to them. There's still a little bit of a ripple on top of this implant here, and these have been very good implants for us, but one of the problems was still a little bit of this kind of rippling there. So the newer generation of implants here are what are called the highly cohesive style, and they are filled more fully with silicone, so you can see they have a little bit more shape to them, give a little more projection on the chest, and there's less of that rippling effect. And at the far end of the spectrum is what's called a form stable implant, and this is the one that comes, you can see, in a teardrop shape, and this has the shape pretty much completely built into it. Now this would seem like a really cool idea because it's shaped like a breast. The problem with these, in order to get the shape, they're a little firmer. So one thing we found, these work really well in breast reconstruction, but for breast augmentation they've got a little bit of an edge on them and they're a little firmer. So I think for augmentation probably they're not quite as desirable as these newer implants, which are round and smooth and have a little more fill in them, but they're not quite as firm. So the point is that we have many choices for implants, and what we try to do is customize an implant just for you. The most important thing is that we determine what your size requirements are and then make sure that implant fits on your chest. And we do that by making very specific measurements and heights and diameters, and then we can choose a device. We have literally hundreds of these to choose from so that we can get one that's completely customized to you. Some of the questions that I would have is, how long do these things last? I would say on average that a breast augmentation will last somewhere around 25 to 30 years. Now that's based on our experience now with implants that were put in 25 to 30 years ago. Now I don't know if these newer generation, which are a much improved product, will last longer, but based on history, you can figure if you get a breast augmentation at a younger age, probably at some point in your life you will need a replacement. So that's something that you do have to consider, is that this is probably not a permanent device, but it should be something that would last you a good long time. And it's very possible too in the future that we won't be using implants, but we'll be using some sort of a clone device or some biological tissue to replace it. All right, we'll look forward to seeing you at Billings Plastic Surgery.